Hi, I'm Olivia Mullins, and I'm going to be talking about my research project. My topic for my research final was what is the most appropriate time to start a preschool child with autism on an AAC device? So, my reason for this topic was this project was important because our role as speech pathologists is to choose the best form of communication for our patients that are functional as and appropriate to use for multiple years throughout their lives. This type of specific research needs to be done because it allows to give an opportunity to identify the best clinical practice for determining the most functional form of communication for our patients and our students. Given what is already known in the field of speech pathology, the relevance of this project is to um, propose the best care delivery of deciding if there is a better time to start a child or a preschooler on an ASC device? And is there a specific device that is more appropriate to use first than others when working with young children with autism spectrum disorder? So, when researching, what did I compare? What did I look at? What did I find? So I researched 5 different articles, and when looking into identifying the best practice, you need it to include studies that include different settings, different types of ASC devices that are introduced to children, as well as maybe studies that look into the people who are working with those specific children, because that can give you good information as well. So that's what I did. Um, so, like I said, during my research, I looked at 5 different studies that took place in different but similar locations. Um, 2 studies occurred within the classroom, as well as speech therapy sessions and occupational therapy sessions, play settings and academic settings. 2 other studies um, were done as well, just specifically in a classroom for students with autism spectrum disorder. And then my 5th study had to do with a population of people who worked with children with autism and worked with ASC devices. There was occupational therapists, physical therapists, speech therapists, nursing, and a survey was sent out, and this helped kind of grab some characteristics that they see during their sessions to see when would be the best time to use a device like this. So the results of these studies. So what did I find? Although none of these studies specified a specific age that is appropriate for AAC device use, they did provide relevant information that answered the question to state my objectives. So that would be, um, you know, there is no time, there is no specific time to start a child with autism spectrum disorder on an AAC device. But what the results did say was that you have to look at their characteristics. What are their strengths? What are their weaknesses? Can they find those certain icons? Can they comprehend that if I click this button and say this as my voice, I will get this? So it's just things like that. But one main problem that can be foreseen when researching this topic is only having small amounts of children in this study, as well as having these children have the same exact characteristics. We kind of want to expand those characteristics and see maybe if this child had this diagnosis and this child had this diagnosis, would the AAC device differentiate, with the time differentiate? So as with any other topic, further research is always great. But I really did enjoy researching this topic, and I think it will help me during my clinical experiences that I'm going through now. So I really, really enjoyed it.